All week long, Fox 5 is trying to help you take back the years.
All right, first up, we're going to show you how giving your hands a little TLC can make you look younger. Claudia, this has to be great news for everybody.
And you can make those hands look even younger without going under the knife. Coming up, we're going to show you this procedure live right before your eyes. Stay with us.
Thanks so much. Are you looking to erase those wrinkles or age spots, have smoother, younger looking skin, maybe get those legs ready for summer? Well, all this week we're going to show you how to take back the years with new cosmetic procedures without going under the knife. Claudia Coffey is live with a growing cosmetic treatment to turn back the hands of time. Hi, Claudia.
Hi there, Gravir. A lot of men and women are probably perking up right now going, wait a minute, you know, a way to look younger without going under the knife. It's true. Here at DC Derm Docs, they're reporting an increase in the number of people that are coming in because they want younger looking hands. That is the key here, folks. We are focusing on younger looking hands. They're using a product called Sculptra. It is an injectable cosmetic product that plumps up and adds volume to the skin.
Melissa Merson doesn't consider herself a vain person, but the busy mother of two admits there is a part of her body she'd like to change.
Anything that draws more attention to my hands, I don't really care for. So,
like many women, she feels the appearance of her hands make her look older.
My hands are, I think, rougher than they might be otherwise, or more gnarly than they might be otherwise, because I had chemotherapy directly into the veins in my hands. I feel like they're very large, and I don't have very attractive hands anyway, so.
Melissa decided to take a bold step that will take years off the appearance of her hands. She'll undergo a treatment called Sculptra.
I like the idea that it's not something that's very artificial and it's going to be there for a very long time.
It's like a collagen injection in the hands. Part of the appeal was that it doesn't stay in your body very long, absorbs rapidly, and stimulates natural collagen development. She has an idea what she'd like it to look like.
Hopefully the veins in my hand won't appear as prominent, and I think that will make me look more youthful.
In the end, she says it's a procedure that she believes is well worth it.
And back out here live at DC Derm Docs, we are going to see this procedure live in the next hour. I'm joined by Melissa, who's going to get the procedure done, and Dr. Marilyn Berzin. She's the co-founder of DC Derm Docs. First of all, Melissa, you mentioned something very important. You said, you know, this is not about, hey, I want to look younger. This is very personal to you because you were treated for cancer, correct?
Correct.
And so that's why you're having this done, because the chemo was injected directly into the veins on your hands.
Yes, right here.
All right, so we're going to get to watch this. Don't be nervous now.
I'm not.
Dr. Berzin, let me ask you, what exactly is Sculptra? We've been saying, you know, it's like a collagen, it's natural. Explain a little bit more what it is exactly.
Well, Sculptra is a polylactic acid that is biodegradable. It is injected under the skin, and it stimulates the growth of collagen and volume. So it'll restore the volume on the hands and help remove some of these vessels, restore a little fat pad, and eliminate some of the tendons that are more visible as we get older.
Now, I understand this has been used before. On HIV patients, you said?
It's been used on HIV patients. It's been used to restore facial volume.
So you can use it in the face, too?
Absolutely. Can use
Not just the hands?
Not just the hands. And what's happening is women's faces are looking better, and their hands show their age.
What are you going to do? How does this work? What are you going to do on Melissa?
Well, we're going to inject the Sculptra under the skin, and you'll have an immediate volume appearance. The hands will look better.
Okay.
And then over the next 6 weeks, it'll stimulate collagen production, and then it will remain.
I can't wait to see this. A lot of people at home very interested because you're not going under the knife, folks. That's the whole key to this thing. And we're going to see this procedure live on the air next hour, so be sure to stay with us.
Claudia.
Well, would you like to turn back the time on your hands? It's becoming very, very popular, and you can do it without even going under the knife. We're going to show you this new procedure live coming up next.
You know, they say you can tell a person's age just by looking at the hands. And when you think of wrinkles, you often think of face and neck, but it's actually our hands that can give the secret away first.
Yeah, so as part of our Take Back the Years series, is it that obvious? Let's go to Fox 5's Claudia Coffey. She's showing us how doctors can rejuvenate the skin. We're taking back the years, right?
Taking back the years. Everybody's getting self-conscious, kind of looking at their hands this morning. Don't look at mine. No, no, no. I keep putting on lotion all morning long. Once again, I'm here live at DC Derm Docs, and a procedure that's becoming more and more popular here is called Sculptra, and it's the focus on the hands, making the hands appear younger, wrinkle-free. Let's reintroduce you to the patient that's getting it done. This is Melissa. She's going to get it done on her hands. This is Dr. Berzin, and she's getting ready to begin the procedure. The key to this here is that it's, obviously you're not going under the knife. This is an injectable polylactic acid that she's going to inject. And where exactly are you going to do this, Dr.
Well,
Berzin?
what we're going to do is we're going to inject in the depressions here in between the tendons. That's where we need to plump up the volume so that these vessels and these ridges will become less noticeable. So we just basically go up and down.
Okay.
I've already done 3 little injections.
Oh, you've already
here.
done some things.
Just
okay.
3 right
Wow.
here.
And you've already numbed it too. Everybody probably missed that earlier.
We did. We used some topical numbing
and what exactly is that? We say that's a polylactic.
It's a polylactic acid, and it is a biodegradable material, just like sutures, biodegradable sutures. And it's injected where you want it, and it will stimulate new volume, new collagen production in these areas. Now,
Melissa, how you doing?
I'm great.
Do you feel anything at all?
I feel the injection.
Does it feel like a little tiny pinch, or does it hurt very much? Just a little pinch.
You know, it feels like an injection. I don't know any other way.
You're not screaming, so I think you're okay.
Right.
Well, that's good.
Okay.
Dr. Berzin, that's always good.
right, we use a small needle, and we inject a certain amount of volume. Some of that volume will disappear over the next few days. After the product is injected, we need to massage the area very vigorously so that it's spread very evenly.
How soon will she see results?
She will immediately see some volume, then some of it will disappear, and then over the next 6 weeks, the new collagen will be stimulated, and she'll get from the first treatment about a 20% improvement.
Will she have to come back for more treatments?
Yeah, it varies on the patient. It can be anywhere from 1 to 3 treatments. They're usually spaced 6 weeks to 2 months apart.
All right. And is it safe? A lot of people want to know, hey, I'm not going under the knife, but is this safe?
Oh, absolutely. It's been around for many years
used on HIV
and
patients.
used on HIV patients. And we've used it mostly on the face. But
well, we're going to let you finish the hands, and we're going to come back next hour and show the finished product. And of course, we said you may not see exactly what it's going to look like, but we do have some before and after pictures that we can show you as well. But it doesn't really take long, about what, 20 minutes?
Yep.
Total? Okay. Next hour, we're going to see the finished product. Back to you then. And coming up, we are turning back the clock on Melissa's hands. Coming up, we'll have the results live of her cosmetic hand procedure. Stay with us.
Thank you. Most of us abuse our hands and we don't even know it.
Okay, whether it's not using moisturizer or sunscreen, working in the yard, you name it, our skin clearly shows signs of aging. Claudia Coffey's live with tips on taking back the years. Claudia.
You know, this is all making us so self-conscious here. We've all been looking at our hands all morning long. We've been focusing on a procedure that makes the hands look younger. It's a quick, relatively painless, and you don't have to go under the knife to get it, treatment called Sculptra. Dr. Berzin has been doing this treatment on Melissa, and it actually takes about 20 minutes, and we've been watching the process throughout the last hour, and this is the finished product. So let's take a look. Dr. Berzin, what do you think?
I think she looks great.
It already looks fuller.
Absolutely.
And that's the look that you want.
Exactly. Now, what will happen here is some of the volume will initially disappear, and over the next 6 weeks, it will restore itself slowly. She will get anywhere between a 20 to 30% improvement with her first treatment.
Right. She'll have to come back for additional treatments.
Exactly. Now, how many treatments depends on the patient and how much volume loss you have to begin with, but between 1 and 3 treatments is the norm.
Okay. And this is not exactly, like we said, what she's going to look like. This just happened, so, you know, everybody has to kind of think a little bit that this is not going to be the finished product, but we do have a picture we'd like to show you, a before and after, if we can go ahead and show that, of somebody that had it done and what the finished product actually looks like. Maybe we don't. Here we go. So there's the before, and that's the after a number of treatments and after letting the swelling go down. So Melissa has a lot to look forward to with what that end result is going to look like. Melissa, do you like it so far?
Looks great.
What did you tell me earlier? Like I said, what was